Okay. Hi. Good evening, everyone. It's really a pleasure to be here, and I very much appreciate given time to share with you what harm reduction services are in Maryland and how we're continuing to operate throughout the pandemic. I'm Erin Russell. I'm chief of the Center for Harm Reduction Services. It's a newer, well, it's about a year and a half old now, but I still consider it new, office within the Maryland Department of Health. And I have no disclosures to share before launching into this presentation. In the next 20 minutes, I hope to communicate to you, again, what harm reduction services are available in Maryland, the impact of COVID-19 on overdose risk, then how it's also impacted the availability of harm reduction services, but the creative ways that programs have adapted to ensure that there's continuity of care within a harm reduction network of care for people who use drugs in Maryland. And then I know Dr. Olson's presentation will go more into a specific clinical guidance and the ways of managing working one-on-one with a patient. And so my presentation will be a little bit more high level and talking about from the Maryland Department of Health, how we've supported our programs on the ground through the policy changes and through that adaptation that I mentioned. So first, the Center for Harm Reduction Services is housed in the Prevention and Health Promotion Administration. I'm required to show you this slide, but it's helpful because it allows me a chance to say, I think, how appropriate it is to have the Center for Harm Reduction within Prevention and Health Promotion, because we work alongside those who provide services for infectious disease. And the priorities of the Prevention Health Promotion Administration include community-based health efforts and working very closely with partners to get the work done, which we have strong relationships with local health departments, community-based organizations, providers like you, behavioral health treatment providers, and others. And also there's a strong focus on at-risk and vulnerable populations. The bureau that we're in that focuses on infectious disease also houses HIV prevention and treatment, hepatitis C prevention and treatment, linkage to care, also the Maryland AIDS Drugs Assistance Program, other STI prevention efforts. So we're in good company to really look at the full spectrum of drug user health. And so the Center for Harm Reduction Services has its own vision and strategic goal. Our overall goal is to reduce substance-related morbidity and mortality by optimizing services for people who use drugs. That's our vulnerable population and our niche that we're very focused on. And that means people who are actively using drugs and may or may not be engaged in care. And what are the services that we can provide to them to enhance their quality of life and improve their health? And we believe that by investing in that, we will have a public health impact of reducing substance-related morbidity and mortality. And we think that will happen in a Maryland where healthcare and social service systems meet the needs of people who use drugs in a comprehensive and community-based manner. So we very much focus on comprehensive being addressing all of the needs of a person who uses drugs. So that's, mental health as well as substance use disorder treatment needs, infectious disease, wound care, and then those that are driven by social determinants, housing, transportation, and others. And then having those services be brought to the community, be community-based as much as possible. Secondly, people who use drugs should have equitable access to high quality care. So we believe in measuring the quality of harm reduction services and the care that people have access to. And finally, services provided to people who use drugs are free from stigma and discrimination. So one thing that the center focuses on that I won't get into too much detail today is capacity building and training. So we do a lot of community training to address stigma, and we do a lot of work with providers who would be serving people who use drugs to build their capacity to do so effectively. And so the major programs within the center are naloxone distribution, for one. We're responsible for distributing naloxone all over the state of Maryland. And we get it out into communities through what we call the Overdose Response Program. And we approve overdose response programs, and it's, we have over, I think, about 150 at this point. And those are community-based organizations like nonprofits, law enforcement agencies, treatment providers, coalitions, parent groups, quite a variety. And so we support them in getting naloxone to their community. We also do some direct training ourselves at large events and for specific groups. Secondly, we oversee syringe service programs. So that is the provision of sterile injection equipment to reduce the transmission of infectious disease. But they're called syringe service programs because it's not just about the syringe exchange, not just about the needle exchange, but syringe service programs provide a variety of other programs on site, including overdose prevention, but also are like often the first place that people go when they're ready to make a change in their life and want to be connected to a treatment program or other service. And so syringe service programs do an excellent job of connecting people in active drug use to the rest of the system of care. We fund naloxone distribution programs and syringe service programs, as well as a variety of other harm reduction programs through our access grants. And that, that includes, integration of HIV testing and linkage to care in buprenorphine programs. We also fund the testing for hepatitis C, street-based outreach, and really anything that serves people who use drugs. We really, so it's hard to say like we just have one, harm reduction isn't just like a list of programs. It's really just about how you engage with someone, how you suspend your judgment or hold any conditions about their drug use, and just provide the care that's needed at that moment in time. So really anyone who's willing to do that can apply for a grant with us, and we'll support you and appreciate the partnership from diverse partners in achieving that. And then finally, I mentioned that we do a lot of capacity building. The Regrounding Our Response program is a major program that does training of the public. So if you have questions about that, it's just, you can follow up with me. I have my email address at the end. I can connect you with training opportunities for your staff or any coalitions or groups or community groups that you work with. And it's general training on harm reduction and then public health theories that contribute to substance use and the opioid crisis. And finally, we also support law enforcement assisted diversion programs by providing the training to all law enforcement agencies as they embark on that, to launch that new program. So it's a variety of things that we do in the center. We're very busy. What I'm going to focus on in this presentation is overdose response programs in naloxone and syringe service programs, because those are what have been continuing to could provide services in amazing ways. So I'm very excited to share some of the approaches that they've taken to continue to get supplies to people who need it. So while this isn't a presentation on COVID-19 and any other epidemiology about COVID-19, I just included one slide to shape the presentation. You can get the most up-to-date information if you're not already aware at coronavirus.maryland.gov. There is a very user-friendly dashboard there. This was pulled on September 15th. It just shows the total cases in Maryland in blue, but then the daily case numbers over time. So seeing that cases have leveled off and declined, leading to the governor's decisions to a phased approach to reopening Maryland. But throughout COVID-19, prevention measures, while they've been successful at leveling off the new cases in Maryland, across the country and in Maryland, as I'll talk about, we've seen an increase in drug-related overdoses, both non-fatal and fatal overdoses. So one of my main messages, and what I just can't stop talking about, is that we must remain vigilant of substance use. And I know that I'm probably preaching to the choir with this audience. So I'm grateful to be in good company. But it's very easy to be so focused on COVID as we should be, but there needs to continue to be a balance of addressing the opioid crisis, because we are seeing a dramatic increase in overdose deaths across Maryland. This was released today at noon. So I had the fortunate opportunity to quickly update my slides so I could share the latest data with all of you. The Opioid Operational Command Center is the governor's coordinating body for the opioid crisis at the state level. They publish all of the reports on overdose data for the state of Maryland. So I do include a link in the presentation. So if you download the slides, you can find the link easily, or just Google before it's too late at Maryland, and it'll come up on your Google search. But Before It's Too Late has all the resources relevant to Marylanders on the opioid crisis. But that's the source of this report. We wait for the OOCC to publish it every quarter. Unfortunately, it's not super timely, just through second quarter of this year, which means it's up through June, January through June of 2020. So as you can see, there's been particular increases in Garrett, Allegheny, Washington, the Capital Region, Cecil County, and then parts of the Eastern Shore. And Baltimore City's increase is moderate, as well as Frederick and Charles County. So we are taking a deep dive into the counties that are seeing such dramatic increases in overdoses and working closely with the local health department to address it. We've seen increases with all substances. I'm sure we're not surprised to see an increase in alcohol-related overdoses. This chart compares the increases from the same time in 2019 to this through second quarter of 2020. So you just see where we were last year. And last year was the first year that we saw a slight decline in overdose deaths in Maryland. So unfortunately, that trend has not continued. And this represents for this quarter through second quarter 2020, all of the overdoses that involved a combination of another substance and opioids. And I like to share this just to emphasize that most overdoses are combination deaths or related to a combination of different substances, but opioids are involved in the majority of deaths. I know that there's been reports of more methamphetamine use, particularly in St. Mary's County and Cecil County. That's something our syringe service programs share with us. But even identifying that trend, it's helpful to know that methamphetamine deaths still are, the majority of them are mixed with opioids. So we're still working within an opioid crisis as much as a polysubstance crisis. So in response to COVID-19 and around March, our offices all went remote. We've been working from home since then. Many health departments had to shut down, close their doors, or slow services. But harm reduction was always considered an essential service, along with behavioral health treatments, medical services, and the like. So fortunately, we were able to lean on that and really have an emergency response to this. And we immediately reached out to our programs to identify what they needed and ensure that we could find ways to support them in moving forward. So that involved informing them of different policy changes, organizing collaborative learning calls so that they could talk to each other and work through this together. And also, we're currently working on some video project to show what it's like to provide services with a mask on or in a socially distant way. So stay tuned for that. It will be released shortly. But we're constantly trying to think of what our programs might need so that they can continue operating. and one thing I'll highlight is number 3 on here, but purchasing and distributing extra supplies. So we're able to quickly purchase hygiene kits. A lot of our programs have distributed hygiene kits, and on outreach, it's probably it's the number 1 thing requested when you're doing outreach. I've been throughout the pandemic helping one of our organizations do outreach in Baltimore City, and we give out 30 hygiene kits in 5 minutes. It's so fast, but it's also alongside sterile injection equipment and overdose prevention resources like naloxone. A huge lift early on was getting naloxone to opioid treatment programs. I apologize for the acronym, that should be spelled out, but OTP is opioid treatment programs. And with the regulations changes allowing for longer term take homes and for take homes provided to different patients, opioid treatment programs wanted to be able to give them a resource to reduce their overdose risk. So we organized a shipment of, since April, we have provided over 15,000 units of naloxone to 103 opioid treatment program locations in 12 different counties across Maryland. So it was an incredible effort and really reflected interest and commitment on the part of OTPs to doing what's best for their patients. More recently, OTPs have expressed interest in fentanyl test strips. If you haven't heard of those, it's the same thing that you would use to do urinalysis, but you can use it to test a substance that's dissolved in water. It also works to tell you yes or no fentanyl is present. So at the point of use, before someone uses a drug, they can test it. If fentanyl is present, then they can change their behavior to reduce overdose risk. Based on some evaluation in Maryland, we found that people are very responsive to this. Something about the technology, doing the test and seeing that positive result in your hands is motivating and empowering, actually. There's a self-efficacy part of it. Some studies have shown that the changes to behavior can reduce someone's overdose risk by 30%. So we've seen some great behavior change from that intervention. So OTPs are also receiving fentanyl test strips and giving them to clients and patients. Finally, we're pursuing grants for telehealth. The Opioid Operational Command Center gave the Center for Harm Reduction Services some funds to launch a telehealth program. So we're going to bring telehealth to a syringe service program location. So someone walking in to pick up syringes, sterile injection equipment, can also then virtually interact with the provider, maybe show them a wound that they have on their arm, or show them a wound, talk to them about buprenorphine, or get assessed for hepatitis and hepatitis treatment. So we're really excited about that. Again, it's an example of comprehensive services being brought to the community and provided in the community where people are. I already shared that stat, so I'm gonna breeze through that. All right, because this is really that's the only point I want to drive home about what we've done with naloxone. We've continued to purchase large amounts of naloxone for our programs. I really hope, my personal mission is that no program in Maryland needs naloxone to give to their community or to give to their patients. If you are affiliated with a community-based organization or a community group that wants to hand naloxone out, please reach out to me and let me know, and we'll help make that happen. I'm going to switch gears to syringe service programs. Very quickly, federal agencies released guidance for syringe service programs to continue services throughout COVID-19. There was a strong message from both advocates, federal agencies, that syringe service programs and other harm reduction services should be essential. Fortunately, in Maryland, Governor Hogan acknowledged that early on, and so we didn't have to fight for that. It was accepted, and we, we made sure to communicate that to our programs. But these are some resources that were provided to inform how programs move forward. So that's from the CDC, from NASDAD, and in the upper right corner, the National Harm Reduction Coalition released some specific guidance for people who use drugs about COVID-19. And one thing I'll just highlight about that handout is it's helpful for programs as they're educating the people they serve on COVID-19. Certain service programs, because they're communicating regularly and have built trust with the community, we're often the first ones to talk to people who use drugs, to talk to their community about COVID-19 and what's going on and how can they protect themselves. So we really at the center see certain service programs as our connection to the community to get information out, not just about safer drug use, but about what's going on with COVID-19. Getting flu vaccines. That's another example of kind of something that's a little outside of the scope of harm reduction, but still extremely important for that community. So I'm going to do a quick time check. Okay, I am pretty much out of time. So I've highlighted some of these challenges already, and so I've just got a couple more slides if it's okay, if I breeze through them just to share, again, examples of how programs have overcome these challenges. Obviously, there's been a reduction in the accessibility of other services for programs to refer people to. This is what is reflected most in our data from programs throughout the entire last year. This kind of shows all the different services that certain service programs have connected people to, and a very sad decline from Q3 to Q4. So from March, the first quarter, January through March of this year, and then April through June, just a big drop off in connection to wound care, testing, and other services. So this could be a couple things. It could be, I believe that services are less available, so definitely related to COVID. Also, that service provision has changed. So outreach encounters happen more quickly. You're not sitting down with somebody and talking through what their needs are and thinking through what an appropriate referral might be. You just don't have that time with somebody anymore, unfortunately, unless it's done virtually. But for a lot of the programs, they're switching to doing a very rapid outreach or delivery of supplies. So I think that shortening of the interaction time might lead to a reduction in referrals as well. As well as I've already mentioned, the rapid delivery, a lot of outreach, wearing protective gear, personal protective equipment, also doing home deliveries, leaving things on a doorstep, or if someone doesn't want you to come to their home or doesn't have a home, doing delivery on a park bench or elsewhere, just very creative ways of getting supplies to patients. And also offering to arrange transportation if needed. We have been flexible at the state level with our funding to cover transportation in this way, as well as housing. We've also funded some rapid housing and hotel stays for people so they can quarantine if they have unstable housing. And these are just some pictures of our programs in Baltimore City, doing, again, street outreach, wearing protective gear, wearing, again, the logos, getting everything branded as their way of being recognized on the streets. That's very important. So having a branded mask also helps to send that message. And so this is my closing slide. It just shows that despite all of these challenges, programs have enrolled still over 1,000 people and served many, many individuals during this time. I still think this is an incredible, astounding number. And every single one of those encounters is an opportunity for encouragement, for a kind word, it's a touch point in an otherwise really stressful and lonely time for a lot of people. So it's just so incredibly important that we continue supporting our harm reduction programs. And providers can prescribe naloxone and direct patients to an overdose response program or a syringe service program. So I just want to highlight that. We're still operating. We're about to publish an updated guide on our website that lists all of our syringe service programs and their new hours, because they're changing rapidly. So the last update was in June. We just updated it again. It's going to be posted imminently. So check our website, connect with your local health department and your local harm reduction program. And thank you for all the work that you do. I'm going to stop here to hand it over to Dr. Olson, and I look forward to your questions.